Okay, good morning, doctors. Welcome to Spinal Ligament Injury Management and Tips. Before we get started, I just want to check to make sure we've got good sound. So if somebody would just type into the question box, yes, I can hear you. I can hear you just fine. There's a question box to your right, and I just need something. Okay, great. Perfect. All right, so this morning, this afternoon, depending on where you are, I guess, in the country, or where you are in the world, I'm going to do a program, and what I set out to do was one on spinal ligament injury management and tips, which I intend to do. I intend to deliver that to you this morning. But when I was looking at it this morning, I didn't like it. It was a program that I did from 2015, so I changed it quite a bit. And what I want you to know is I want you to stay on this program, this full program this morning, because you're going to get something out of it, I can 1,000% assure you. Because there was a message that I realized in 2015 when I presented this that was completely missing. And I don't want you to, I don't want to do that again to you. So with no further ado, I'm going to get started this morning on management and injury tips. My name is Dr. Cronk. I'm the Director of Education for Spinal Kinetics. I'm also the founder of American Spinal Injury Impairment Consultants. I have dealt a lot with spinal injuries, spinal ligament injuries, all of this type of information. And I want to give you a little bit of my background. I was in clinical practice for 17 years. My first 8 years of my private practice, I did general practice, which means that basically what I did is I did examination procedures and I did adjustment procedures and I treated all kinds of patients. I treated Medicare patients. I treated Blue Cross Blue Shield, natural, normal health, cash, auto, work comp, and I did a whole mix of things in my private practice, probably like a lot of you are doing currently. And after 8 years of private practice, I was bored stiff because it was boring. Now, I was very, very good at what I did. I was good at selling programs. I was good at doing what I knew to do at the moment, at that time. But I knew that what I was doing, any person could do. I knew that it didn't take an 8-year education to do what I was doing. Patients were coming in. I was using a generalized treatment plan, generalized adjusting, diversified adjusting, and I was doing general examination procedures. Most of the procedures that I was doing had zero relevance. They didn't tell me much. So most of the orthopedic testing that I was doing didn't tell me anything. The range of motion really didn't tell me anything. And so the biggest thing that I was seeing that there were loss of curvature, and I knew that there was normal alignment. I was taught in school there's this thing called normal alignment. And I knew that when I was seeing, especially with trauma patients, and even with patients who would tell me they had no history of trauma, and I would see spines like what you're looking at here. Actually, this is an image from probably 15 years ago, 20 years ago. Not one of mine, but just an image that I pulled. So I would see these images, right? And I knew that there was a problem. I knew that there was no way that a spine could misalign this badly without the casing that was holding it aligned, which is the ligament structure. This intense 220 specialized ligaments obviously were failing, right? So after 8 years of private practice, I realized, and I had a good practice. By numbers wise, if I said the numbers, for some of you, you go, my God, that's a fantastic practice. For some of you, you may say, oh, that's a medium-sized practice. I was as busy as I could be. From the time I hit my clinic in the morning till the time I left at night, I was busy, right? But I knew I was mediocre. I knew I was average at best, and I had never really been average at anything. Everything that I did, whether it was sports, whether it was school, I just wasn't really average. So at that point, I decided that I wanted to either quit or be one of the top 2% of the people that could actually realign the spine. So I knew that there had to be ligament damage here. I knew that. And I knew that forward head posture caused a lot of different problems, right? So I was in with all the postural analysis, and that for every inch of forward head posture, 10 pounds of head pressure, 10 pounds were added to the head, and that the neck and the muscles would have to hold that up long time, long period, right? And I knew that if I looked at Rene Callier's work, he was the father of rehabilitative medicine. It was amazing. You know, he'd say, look, loss of lordotic curve, loss of function. And if you had that, you had loss of lordosis in the cervical and the lumbar spine. So a lot of you struggle with, gosh, why do I do full spine adjusting? Well, if you have a problem in the lower spine, you have a problem in the upper spine. Right now, if you're strictly an Atlas provider, you're an upper cervical specific provider, that's a whole different ballgame. But if you're a full spine adjuster, you have problems in both. So as soon as you have this loss of curve, which is caused by a ligament injury, you have loss of mechanical curve in the lumbar spine. Okay, the neck, depending on who you talk to, which group, is either the third most common cause of disability or the fifth most common. The low back is the #1 most common. So I knew that we were definitely onto something when there was misalignment, and I knew it was caused by ligament damage. I just didn't know what to do with it. I didn't know how to diagnose it. So I knew that forward head posture also affected the ability for the patient to experience more pain because it reduced down the endorphin production, natural pain reliever produced in the body and produced in the spine. Now, who was saying this? Rene Callier said forward head posture can add up to 30 pounds of abnormal leverage pressure in the spine. Okay, I knew that causes degeneration. I knew that that causes chronic fatigue. That could cause headaches. That could cause neck pain. That could cause just about every symptom that I had in my practice. I knew that, right? And I also knew this, that it could cause loss of vital lung capacity. Lung capacity can be reduced by as much as 30%. So that shortness of breath and the reduction of oxygenation, now the body, you know, adapts to it by producing more red blood cells, producing more hemoglobin, right? But all of these things cause the body to experience conditions. Asthmatic people and kids that had asthma. I knew that this was what was contributing significantly, if not the actual cause. And I also knew that it had a dramatic effect on the intestinal system. So I knew all that. So I knew when we were correcting the spine that when we were correcting the spine, these are all the things we're improving. And these are the old ways that I used to show patients how spinal alignment affected the rest of their body. So I'd have a spine up, I'd have a 10-pound ball you can get anywhere, you know, any sporting goods store, and I'd say, okay, look, here's what it feels like when it's in normal alignment. Everything's in balance, including the muscles. Here's what it's like when it's straight. Gosh, here's what it's like when it's straight and forward. Now, all you had to do is have a patient hold that for a minute or two, and they got the idea of it. They got the idea of it that it should go from here to here, and that's what I based my clinic on. Now, what I based my career on is the fact that in order to get from this to this, ligament damage, chronic or acute ligament damage. And the patient that has acute ligament damage, just got injured, it is 1000% imperative that they find a doctor that understands the ligament condition. So, you know, when I'm going to skip this slide. When we had this ligament damage and we had this forward posture and the patient actually had, they could have all kinds of things. They could have high blood pressure, they could have breathing problems. And this was all explained, so I guess I'm going to go back to that slide because that's what I originally, what are you going to say to this patient? So this patient just comes in, you just took x-rays. Now, some of you don't take x-rays, we're going to talk about that. But what are you actually going to say to this patient? Well, you might ask this patient if they've ever had a history of high blood pressure, if they've ever had a history of breathing problems, if they've ever had a history of bowel problems. Now, when you have patients, what I found with patients that would communicate, and I know I'm going to jump around here a little bit, but one of the things I found in my private practice was that patients, especially female patients, were having bowel movements every 2 days, 3 days, 5 days, 6 days, as much as 2 weeks in my practice. I had no idea that was going on in my private practice. Now, when I would come in and say, well, gosh, do you have a history? I know you didn't come in for this, but I just want to ask, based on your x-ray study, based on what I'm seeing on your x-rays, have you ever had problems with your bowel? Yeah, well, how often do you have a bowel movement? Well, I have a bowel movement every 2 days, 3 days, 4 days. Doctors, do you realize the health impact that it has on a human body to not have a bowel movement 1 to 3 times per day? So, of course, what would we do? We put them on a corrective program to correct the misalignment of correct the actual alignment of their neck. And we would also have them take a magnesium supplement. Really, really simple. Just dose. All you had to do was dose the supplement till they went loose. Pick a calcium supplement. Natural Calm was my favorite. You pick a supplement. You say, okay, put a tablespoon of this in water. You may go loose right away. If you don't go loose later in the day, put another tablespoon. They're going to go loose. As soon as they go loose, you back it down, and you figure out what keeps them from being super loose, what keeps them being normal and regular. And then you realign the spine. And the digestive problem with not having bowel movements will subside. It will go away, in my experience. Now, my experience also included realigning the spine, and we were good at it, really good at it. I, was part of research and developing, helping to establish protocols where we used head weights, right? And in those head weights, we corrected forward head posture. My clinic in Seattle, Washington participated in these studies. And so all we were using was a simple head weight. Now, there's a technique to it. I'm not going to say, there's a technique to it. You checked out the size and the scope that you needed to use, and that was done through the Pettibon Institute. So any of you that are interested, you call the Pettibon Institute. They have online training programs. It's so simple to learn how to use a simple head weight. Now, I also realized at that time I could look at studies just like you can look at. And on these studies, it would say, gosh, if you had a whiplash patient, that they had nearly twice the rates of neck pain, headaches, breathing disorders. Where were those breathing disorders coming from? They were coming from what I just showed you. Low back pain, what was it coming from? What I just showed you. Cardiac problems definitely can come from what I just showed you. Digestive disorders, absolutely. Right? So in 2008, or excuse me, in 1997, so just to kind of bring you up to speed, I started my own private practice in 1989. So 8 years later would have been 1996, 1997. I learned about corrective care through the Pettibon Institute. At the same time, I learned from Pearl Pettibon that it was the ligament that was causing the problem. And at that time, I met a guy named Harold McCoy, who had a ligament testing company called Spinal Diagnostics, and he taught me what intersegmental motion testing did, and it changed my life, it changed my career. Because now, for the first time, I knew how to diagnose a ligament injury, and I could do it on a regular basis. In 2005, I started a company called National Injury Diagnostics, and I did it for 5 years. In 2010, I merged that company into Spinal Kinetics. And at Spinal Kinetics, we're a medical company that all we do, our whole mission, is to reduce down the chronic nature of problems in the market today through early, accurate diagnosis of the ligament condition. It's absolutely 1000% the key. So a doctor does an exam on a patient. Everybody, all of us did exams. We're all going to do exams. right? Now, the key to the exam is what we're looking for is we're trying to figure out what is causing the symptoms, right? That's called diagnosis. And so in our exams, we should be doing motor testing, sensory testing, and pain correlation, looking to what level does the pain come from. Is it coming from a C2 level, C3 level, C4 level, C5 level, C6 level, thoracic spine level, lumbar spine level? If they have pain going down the arms, is there a problem in the brachial plexus area? So what we do, and we're supposed to do, which is really degenerated today, unfortunately, a lot of what passes off as testing, and I know I remember deep in my heart, when I was doing the majority of my testing in the first 8 years of my private practice, I knew it really didn't matter. I knew that what I was going to do, it didn't really change my treatment plan much. I had an idea of what I was going to do. And I, like many chiropractors, really looked at my testing and goes, my testing didn't tell me much. Right? Your testing can tell you a lot. That's why we developed spinal kinetics. That's why I developed National Injury Diagnostics before it. Right? You can do simple motor and sensory testing. So if you want to do a motor test for C1, it's neck flexion. If you want to do a motor test for C2, it's neck extension. Neck lateral flexion for C3. Shoulder elevation for C4. Elbow flexor, C5. Wrist. We have these. I created this form because I realized doctors were not testing anymore. And they weren't correlating what they were finding. They had become super generalists. And that super generalist idea compounded with the medical major market that didn't understand these conditions at all, and that was the cause of the chronicity, right? So you could take and you could determine. At Spinal Kinetics, we knew a doctor could take stress radiology. They could take stress x-rays, and that they had to have a great place to send those to get them measured. And that once you measured them, you could look and say, oh, wow, I got a C6 problem. Okay, C6 on C7. So I've got a C6 or a C7 nerve potentially that's problematic, especially C7. So I go right in here and I could check. Gosh, do I have a C7 problem? I could do a sensory examination. Do I have a C7 problem? Right? And what you're going to find is that this correlates like magic. Right? Now, what it does is it allows you to diagnose properly the patient's condition. So, and it doesn't matter what this is. Now, this has ramifications to injury documentation that is off the charts, not for today's discussion. Off the charts of what it can do. What it can do for all of your documentation, and what it can do for you as an individual, and what it can do for our profession, and what it can do for the patients in the United States and across the world, for that matter. So, what are common ligament injury symptoms? Or if you have a ligament problem, what are common symptoms? Well, common symptoms are neck pain. Common symptoms are migraine headaches. Common symptoms are headaches. Common symptoms are lower back pain. Common symptoms are visual disturbances, shoulder pain, scapular pain, pain radiating down the arms, pain radiating down the legs, ear pain, ringing in the ears, numbness or tingling or a sense of weakness or heaviness in the arms or the legs, bladder dysfunction, neck pain. We could have severe fatigue, sinus congestion, chronic. We could actually have concussive syndrome that won't abate, dizziness, problems with concentration. Now, doctors, if I'm going to ask you, what other conditions are patients coming in to treat with you for? Okay, these are the common things that you find with ligament injuries. Now, this isn't common because Dr. Cronk says it's common. Anybody can go out to Medscape or to any major medical website and find these symptoms listed with a thing called spinal instability. And spinal instability requires ligament damage in order to have it. So those are the symptoms. Now, in chiropractic, most chiropractors have a mix of practice. They have a wellness practice, a musculoskeletal injury practice, or a musculoskeletal practice. Pain, doc, I got pain in my neck. I got headaches. I got low back pain. I got pain running down my legs. I got, pain, pain, pain. Every single thing that you see on the majority of this practice here is in the symptoms chart that I just showed you. Or they've got an acute injury practice. Now, a lot of providers today want to be in this acute injury practice. And I'm going to tell you right now, the best of the best, the highest quality doctors need to be right here. They need to be treating these patients because these patients have a super high risk for long-term residual complaints. Anybody that wants to help people and like seriously have an absolute blast doing it, this is where you want to be, right? Because this right here causes this, and it causes the need for this. This is the most senior thing that you can get involved with, in my experience. Now, most doctors deal with a subluxation practice, but a lot of doctors don't know what it is. A subluxation is a misalignment of the position of the vertebra or a misalignment in the movement pattern of the vertebra that causes nerve interference. Now, it has to cause nerve interference. It's just not, a patient that has a misalignment of the vertebra is not subluxated. A patient that has a misalignment of the movement pattern of a vertebra is not subluxated. They also don't have a spinal instability. The only time they have a subluxation or a spinal instability is when it kicks in a motor, sensory, or a pain problem associated with it. Now, so in order to have a motor, sensory, or pain problem, you have to have a nerve problem. The nerve has to be somehow negatively influenced, right? So a subluxation is caused by what? Number one cause of subluxation is trauma. The number one way to misalign a spine is to traumatize it. Now, the trauma might not have been yesterday. The trauma could have been 10 years ago. And the symptom is now just coming into clinical expression today. But if you look at the spine and you analyze the spine and use the science of analyzing the spine, you're going to find the trauma. And the trauma is usually there to the ligaments. Now, this is what ligament damage looks like. Right? So this is obviously a disc herniation, and this is a ligament under an electron microscope with fibers of the ligament damaged. Now, most ligament damage is not an avulsion of the ligament in the spine. Most ligament damage is a hyperstretch, or what's called a ligament subfailure, which causes excessive motion in the spine itself. And there's 10 ligaments that hold C2 to C3. If those 10 ligaments are damaged, there'll be excessive motion that gets picked up when we do stress radiography. Okay, it's that simple. If you try to actually make this any more complicated, you're just trying to complicate it. And if you can't have it being that simple, I apologize, but it's that simple. Now, we know today that this right here, these findings, and you could also have malposition findings, are the number one cause of pain and disability in the world today. They're the absolute number one cause. Now, 100 million Americans have chronic pain. More than 100 million Americans suffer from chronic pain at a cost of around $600 billion a year. Depending on who you read, that could be $800 billion a year. Economic cost to auto injuries alone in the United States, economic cost, just auto injuries, is $836 billion. Right? So these are big enough numbers. They're big. So what is, when we look at these statistics, and what I wanted to do today was to actually go, okay, let's look at this a little bit, because there's a lot of doctors out there that say, well, I need a better management tip, or I need something that's going to help me to either better help my patients or to get more patients. Most businesses today are suffering from the fact that they have a lack of new people. They have a lack of patients. right? Well, 4 out of 5 Americans suffer from disabling back pain during their life. How many? 4 out of 5. 8 out of 10. So look at the next 10 people. Know that 8 of them at points in their life are going to suffer from disabling back pain. Now, what do you think the cause of that disabling back pain is? It's a ligament problem. Americans spend $86 billion a year on spine treatments, up 65% in a decade. About the same as we spend treating cancer. So low back pain spends, I'm going to tell you it's more, and it's much more, because when we look at studies with cancer and we look at studies with back pain, these are insurance-based studies. And so they don't ever address the work comp issue. And the work comp issue, if you add it into, it's far higher. And it's far more than cancer. Because cancer, you know, very little, there's not as much cancer that's work comp caused. So when we look, again, what is the cause of this? Ligament problems to the spine. Americans spend $20 billion on drugs for back and neck pain. They're spending $20 billion a year. Now, what do you think the co-pays are? How much do you think is out of pocket? It's astronomical. Okay? Do the drugs work? No. They double and sometimes triple the disability rates and the costs. And the earlier they use them, the worse it is. So what is the cause of this? What is the cause of all this disability? Of course, it's the ligament. The proportion of men and women in North Carolina suffering from impairing low back pain is more than doubled since the 1990s, according to New University of North Carolina Medical School study, which strongly suggests that the findings reflect a nationwide trend. Now, I'm going to show you a trend here in a second. Because while all of this trend was going on, and remember, this is reported in 2009. While all of this trend was going on, there was a trend in chiropractic. And the trend was reduction of X-ray, reduction of understanding of X-ray, reduction of diagnosing based off of X-ray. So if we look at this, according to the National Health Interview Survey, percentage of people with lower back and neck pain which could cause impairment more than doubled between 1997 and 2006. It probably has doubled again. It's so bad right now. And it's the cool part about it is it provides the largest, has never been a larger opportunity for practices to not only thrive, but to seriously grow right now. Because what is the cause of this? Well, the majority of clinics, medical and chiropractic in the country, do not diagnose it. And yet it is the cause. More than half the respondents now felt they had no control over their pain. 6 out of 10 patients said they experienced breakthrough pain, that's severe pain, 1 or more times daily, severely impacting the quality of their life and well-being. Yet doctors are trying to find, well, how do we find new patients? Almost 2/3 reported that impact on their overall enjoyment of life. More than 3/4 of the patients reported feeling depressed. Who wouldn't? 70% said they have trouble concentrating. 74% said their energy level is impacted. 86% reported an inability to sleep well. I wrote a program for doctors for injury providers. So I have a program where I help injury providers get more injury patients. And I wrote a thing called Smart Injury Recommendations. And in that, I have a thing on sleep. Because you have to start talking to your patients about sleep when they're injured, because sleep can seriously reduce the healing capability of the body of an injured patient. And they have to get sleep because it has a dramatic effect. Now, what did we just say here? 86% of the people in chronic pain have an inability to sleep well. So, impact on their daily lives? You know, 50% lost a job. So let me just today, you have your job and you're making money and you're earning money for your family. Let me say tomorrow you can't you can't be a chiropractor. You lost your job. Think of the dramatic impact that would have on you. Think of the dramatic impact it would have on your family. You have to think, and you have to start to think with your patient base. And you want to start to encourage their dreams. And they have a dream of a great life. They have a dream of a happy life, great family, great kids. They have their dreams. You need to encourage those dreams. And getting them out of the situations that they're in will help. You need to justify their failures. Well, their biggest failure that they have is they can't find a doctor. And it's not their fault. It's absolutely not their fault. So you need to reduce down their fears that you could be that doctor. And as I'm going to get to here, I want you to stay. I know this is a little bit longer than my normal, but I want you to stay right to the end here. So, you need to help confirm their suspicions that what they've been doing hasn't been working. Now, here's some other things. Excluding minor annoyances, just under half of the adults have experienced pain in the last 2 weeks, and nearly 4 in 10 do on a regular basis. There is no scarcity of patients. I'm going to tell you what there is a scarcity. You might not want to hear it, but I'm going to tell you what there is a scarcity of when I get to the 2 biggest tips that I'm going to give you today. And I'm going to continue right now on this. 6 out of 10 rate their experience with pain as moderate to worse for about 2 in 10. About 40 million individuals, doctors. 40 million. It was severe. 19% suffer from chronic pain, meaning it's ongoing, lasting 3 months or more, and some of these have severe pain lasting 3 months or more. So, what do these patients need? How in the world could you get these patients? Right? What is it that they need to hear? What is it that they need? Well, I'm going to tell you tip number 1. And it's going to sound like the simplest tip. I've said it over and over. But I'm going to do a survey here so that you can start to get some objective reality. And I just want you to participate with me on the survey. It'll be in just a second. Okay, so tip number 1 of big tips is, what do they need? They need an accurate diagnosis. The whole reason why I set up National Injury Diagnostics and Spinal Kinetics was to give the doctors an opportunity to get an accurate diagnosis. Now, it says here by definition, it's the identification of the nature of an illness. What does the word nature mean? Nature is anything physical. So when you look out at nature, in nature, nature's animals, it's the planet, it's the dirt, it's the plants, it's anything physical. Now, that's the main definition that we're looking at here. So it's the identification of the physical cause of an illness or other problem by examination of the symptoms. They need a diagnosis. Now, these are the symptoms. So what we want to do is we want to look at the common symptom and work backwards and say, well, what's the physical cause? Okay, at this point, I want you to participate with me in something. And that's something that we'll probably do more of in the future. So I want to have you take a poll with me. So I have a poll in progress. It just popped up on your screen. What's the most common cause of chronic pain in the spine? What is the most common cause right now, doctors? I want you to participate. I need you to go ahead and punch in. I don't care if there's a not sure. If you're not sure, then you're not sure. But I want you to, only 24% of you have voted. Come on. This is really, really quick, doctors. You're all doctors here. What is the most common cause of chronic pain in the spine? What is the most common cause? I want you to look at this. Come on, only half of you have voted so far. Don't take any time. Just look at it. Is it a ligament problem, stress, muscle problem, nerve problem? What is it? I need your participation. Tell me what it is. Okay, I'm going to close the poll, and I'm going to share the results. Now, that's perfect. That is absolutely perfect. What is it? It's a ligament problem. Okay, now I'm going to hide this, and I have a typo in here. I'm going to launch. It's instead of saying infinitive, it should say definitive. What is the definitive way to diagnose a spinal ligament condition? What is the definitive way to do it? Come on, doctors. You're all doctors. Is it an orthopedic test, tinal tap test? Is it MRI? Is it, you're not sure? What is it? Okay, we have a lot of doctors on the call this morning. A lot of doctors. So just, I need you to participate. I'll show you what it is. What you and your colleagues are saying, I'll show you. Okay, we're going to close it off. Thank you all for participating. We're going to close it off, and I'm going to share it with you. Okay, 100% ligament injuries, 100% you do stress testing for it. Okay, we're going to hide this, and I'm going to do one more. If that's the way you do it, how many of you do it, and how often? Now, the polling is going slow. Come on, doctors. I need more participation here. I need more participation here. Give me just a little bit more. Good. I'm going to close it. All right, and I'm going to show you the problem right now. Go ahead and share. Okay, good. So 45% say yes always. Now I'm going to tell you that those are the rarest doctors in the country today, by my experience. Those are super rare, and the reason why this is so high is because it's a spinal kinetics webinar. And so a lot of doctors show up on a lot of our webinars to get more information, to have better understanding, to be able to explain to their patients better. Now, 50% sometimes, which means sometimes less than 10%. So fit over half the providers. So if this is the condition right here, these are the common symptoms, and we know that the common cause is a ligament injury, over half the doctors, over 55% of the doctors on a regular basis are never testing for what the thing is that causes the problem. Now, let's talk about that a little bit. So let me hide the poll. And let me get this back out. Okay, just I want you to just type into the chat box that you can no longer see that on the screen. Just let me know how many how many doctors right now can just see my screen without the poll box. So I just need to know how many can you see without the poll box. Or can you see? Are you seeing the screen without the poll box on it? Okay, great. Thank you. Okay, so let's go to this. This is the key to understanding. When you injure ligaments, you injure mechanoreceptors, which causes a corrupted message to go right over into the muscle. So when you have a corrupted message, you get a corrupted muscle response pattern. That's called a spinal instability. Now, it means that the activity of the spinal motion unit is no longer coordinated. It means higher facet loads, more muscle fatigue, more strains, and more potential for injury to the ligaments. A lot more tissue inflammation on a regular basis and chronic pain. That's what it means. Now, what is the #1 treatment of that? Chiropractic adjustments. So which segment should be adjusted? Well, it's the segments that actually have the most mechanoreceptor disruption, okay, within your clinical experience. Now, doctors have a lot of questions. That's why I have a program and a training program that I do for doctors, because they have so many questions regarding this area. And the thing of it is that treatment tip #1 then is you got to get an accurate diagnosis. Now, I'm going to give you treatment tip #2. The biggest reason that doctors will communicate that they don't do testing is the costs. Okay, but I'm going to tell you right now that that's not the case. Not by my experience, that's not the case. The biggest reason why a doctor does not do testing is because lack of certainty and confidence. They're not certain that this is what they should be doing, right? So, and a lot of clinics mistakenly try to limit costs to the degree that it costs the patient their results, it costs the doctor's office referrals, it costs them new patients, it costs them results in treatment, it costs them income, it costs them overwhelmed staff, it costs them increased overhead without the ability to pay for the overhead, it costs them nights of disrupted sleep where you're trying to figure out how to get more patients, how to advertise more. It costs you a lot. Now, I did a little analogy here. And tip #2 is you don't let the cost get in the way. So what is the cost of a test? If you want to test for spinal kinetics on a non-injured patient, it's $270, right? So let's say that your whole treatment plan was $5,000. Now, some of you are going, my God, $5,000 treatment plan, oh my God. I could never explain to the patient that they needed $5,000 worth of care. Okay, I'm going to tell you, I'm taking a high level. You may not need that. Let's say they need $1,000 worth of care. Let's say they need $2,000 worth of care. If they needed $5,000 worth of care in your clinic, for the average person, that's less than 2/100ths of their total earnings. Now, so what are the real costs? Well, the real costs are to them, they experience all of this because you potentially may lack the certainty and confidence to do this. So what I'm saying to you, doctors, is once I understood what the problem with the ligament was and the actual realization that I could now diagnose it. I've done a lot of different programs with you. You can go to, again, smartinjuryeducation.com, which I'll get to. I'll go over again. But what I realized was the real cost to the patient was the risk of being with a doctor that did not understand what I'm explaining. And that led to a evolution in my career that was significant. I'm still talking about it today. So now, 20 years later, 2 national ligament testing companies later, I don't know how many webinars, 400, 500 webinars, I don't know how many seminars later, I'm still talking about it. Why? Because it's what needs to change. And when you understand what the patient has, and you can diagnose it, and you don't have to diagnose it. There's other means. You could use a different system. You could use your own system. But what I'm saying is the spinal instability has to be there. And I'm not saying when you do injury work, you want to have it done by an outside, non-biased third party because of all the medical legal problems that come with not doing it. I mean, you want to give yourself problems? Don't leverage unbiased help, because that's the biggest thing you can do when you're leveraging in a personal injury where you're going to have a medical legal situation. So what does it cost you? It costs you a fortune. It costs you referrals. It costs you confidence. It costs you treatment plans where patients don't actually stay on your treatment plan. It costs you the inability to sell the program that you're basically trying to sell. It can cost you so much time I mean, once you understand the ligament, it ties into everything. It ties into nutrition, it ties into exercise, it ties into rehab, it ties into the adjustments, it ties into absolutely everything you're going to study. And it's career changing. That's what's so nice about it. So that's what it costs you. That's what it costs the patient. You know, I did this. I left this slide in here. No, I didn't. It was on an exercise slide or a headache slide. So those are the two tips that I want to give you. One, you need to look more at ligament injuries and diagnose it and get to be an expert at diagnosing them. The stuff I showed you in the beginning about how you can take out bowel movement problems and how it can alleviate breathing problems and how it can alleviate, well, what is alleviating it? Well, you're just addressing the misalignment, the subluxations that are there, and the subluxations are allowing the body to rebalance itself. So you're not treating those things directly. You're treating them indirectly by improving the body, just much like exercise will treat them or diet will treat them. But you're doing it with a much higher degree of precision and certainty, and patients pick up on that certainty. They pick up on it big time. So those of you that are not spinal ligament testing, go to thespinalkinetics.com or call 877-508-9729 and get started with us. There's a whole host of things that you get when you start with us. When you get your referral materials, but you also get a back office that has some information on it. Now, we're an imaging company. What we do is we take great images, doctors that send us good images. You got to have good images today if you're ligament testing. Whether you're a medical doctor, a doctor of osteopathic, a chiropractor, good ligament studies. And with good ligaments or good x-ray studies, with the good x-ray studies, our board certified medical radiologists do a procedure on them to measure how much intersegmental motion there is, which tells you the severity and location of the patient's ligament condition. You do the clinical correlation and you do the explanations. So that's what Spinal Kinetics does. Our mission is to reduce down the epidemic of chronic pain through early, accurate diagnosis of the condition. Something that's basically not in the market today. Smart Injury Education, that's a education program that I do for doctors that trains them how to understand what I'm saying and then how to apply it, use it, and expand your clinic with it. So at this point, what we're going to get into is what I always do is question and answer. So go ahead go ahead and type any question that you have into the question box. Okay, will this webinar be replayed, and if so, how do I access it? Well, yeah, you can first of all, yes and no. In the center, in the place where I actually have training for doctors, all these webinars get played. They're all produced and they're all recreated in those. At Spinal Kinetics, no, usually I don't. We bring you on. We actually go, okay, here's some information, right? There's not an imaging company in the world right now that brings this kind of information to their people. You don't have an MRI center doing what I just did here. You don't have, and on a regular basis, and that's not to pump up me or to say, oh, we're so great or anything else. It's just, it's not a normal trend. So there's only so much information that we will put on our website or in our back office because doctors get confused with it. I hold these programs so that I can answer any questions that you have right now. So if there's questions that you have that you're not understanding, you're not taking anything out of context of what I'm saying, and you're actually able to get the answers currently. Dr. Cronk, where do you come up with ligament injury being the #1 cause of chronic pain? Where do I come up with it? Because I look. I look and I look at the statistics and I look at, just like you in the poll, we had in the poll today, what is the most common cause of chronic pain in the spine? 100% ligament problem, 100%. So all I do is I look, and there's a lot of things that I look at. And one of the biggest things I looked at was the impact that it had on me and my patients in my own private practice. Can you have ligament damage without seeing the instability on stress views? Can you correlate with Dynaron? Well, here's the thing, doctor. This is a fantastic question. So I want you to, doctors, I need your participation. This is a fantastic question, right? And some of you, sometimes in my group, there's a really easy way that I address questions. Okay, doctor, the doctor that just asked this question, I want you to type in, I'm going to ask you a question. Can you see ligament damage without seeing instability on stress views? Can you see, doctor, I need you to answer the question. Can you see ligament damage without seeing? No. Okay, no one in the world can. No one in the world can. That's why it needs to be diagnosed. That's why the imaging is so important. Okay, now the other parts of the question, it was a great question. Can you correlate with Dynaron? You should be able to correlate with any kind of testing you're doing. Absolutely. Okay, so Art Croft last weekend stated an alar ligament study, lateral AP open mouth is actually a capsular ligament injury. Thoughts? Yeah, a ligament injury in my world is a ligament injury. So you're going to have people who are studying people who study, right? So Dr. Croft is a person who studies people who produce research, and he's done a lot of research. He's created a lot of research himself. So you have people who study research. And God help them. I love the fact that they're willing to take the time to study research, because when I study research, it's so all over the board, it's unreal. And I realized that if we knew the answers to these conditions, which I'm glad these ligament conditions are coming up more and more, then the environment would be changing. So it doesn't matter in my world if it's alar ligament or it's capsular ligament. It doesn't matter. Okay, it doesn't matter at all, because it's a ligament condition, and all ligament conditions pretty much respond the same. You have mechanoreceptors embedded in them, and they communicate directly into the neuromuscular control system, which manages the whole muscle system around it. So if it's damaged, the mechanoreceptors are offline. And I can go with facet as well as alar ligament. Okay. Here, I'm gonna do this again. You can conclude ligament damage with Dynaron study? Question mark. I don't have any idea. I don't know anything about a Dynaron study. Some tears or instability can be missed due to muscle guarding. Again, it's a question mark. Really? The only way that you miss these tears, or you miss what shows up on X-ray, is if the patient cannot perform the procedure. Other than that, you don't miss it. And this is coming from somebody who's done, I don't know how many studies I've been involved with, 40,000, a lot of studies. Okay, what's next? Any other questions? Any other questions with you doctors? Okay, if I want information on the training, if you want information on the training program, you just go to smartinjuryeducation.com. I would highly recommend that if you want to get involved with a very inexpensive program, it's very inexpensive now. What I mean by that is it's astronomically cheap. It's being revised currently, and the revision is going to come out, and it'll be at a much higher cost. Because what I'm finding is when doctors are exchanging something with it, they apply it, and when they apply it, oh my God, do they get the results with it? So the thing comes in the application. Okay, on the next program that you'll see coming out in 2 weeks, I'm going to do a program. Good. So sorry, I didn't answer this doctor's question. It's a great question. Why are spinal adjustments good for ligament damage? That is perfect. Let's really make sure that that question gets answered. So let's go back. I need to go back to a slide. And I need to go back to this slide right here. Okay, so when you damage a ligament, so let's go to here. Okay, when you damage a ligament, they show up as excessive motion, or you damage a ligament, or you damage a ligament. The ligaments are loaded with mechanoreceptors. Now, a mechanoreceptor is a pressure receptor, and it transduces, it changes pressure into a signal. And the signal goes right across the spinal cord and has the muscle adapt to whatever signal the ligament is giving. So the muscles respond instantaneously in real time to the needs of the spine and the spinal position at that moment. I mean, what are you doing? Are you sitting in a chair? Are you lifting a car? Are you lifting a weight? Are you taking out the garbage? What are you doing? So it's responding to the muscle system is responding to exactly what the need is based on the pressure in the ligaments. So this spinal cord and the nerve system, the communication system, is called the neuromuscular control unit. So if you damage the ligaments or impair the ligaments, the mechanoreceptors go offline, and you have a corrupted message, which causes a corrupted muscle response pattern. Now, corrupted muscle response pattern can be, hey, look, I'm bending over to pick up a piece of paper, and my back seized. Well, why? Well, because unfortunately, the muscle response that your ligament gave off was that you were lifting a car, not a newspaper. And it engaged muscles that were inappropriate for the lift you were doing. And that caused the seizing of your lower back. It can cause more ligament damage. You can hear a pop associated with it. It can cause more ligament damage. Or you can actually have an under, so where it's underperforming, where it's not actually engaging the muscle at all, and all the pressure went right to the ligament, and that's when you hear the pop and you have the inflammation and everything else. So what a adjustment does, and what it has always done, is it has a dramatic effect on bringing the muscle or the mechanoreceptors back online so that the communication system is restored and muscle stability, spinal stability is restored. And that's what you're doing when you're adjusting the spine. That's why it works. So that's that's what an adjustment does. And I hope that answers you. Wow, we got a lot more questions now. Okay, good. So let's. I like your clinical exam form is available, and from where? From whom? Well, you can purchase it through www.smartinjuryeducation.com, or I have a copy of it. Here's the thing. Here's what I'm going to tell you. The form itself is good. If you're talking about injury, you're talking about regular examination, it's perfect. But it's the other materials around it that really make it like really good. But if you just want a copy of it, if you're a doctor who utilizes spinal kinetics, it's in the spinal kinetics back office. If you're a doctor that doesn't use spinal kinetics, you go to www.smartinjuryeducation.com and you sign up for that program, and you can get a copy of that. Okay, so the question is by this doctor is, do you still adjust it even if there's already a hypermobility? Well, a hypermobility is part of the subluxation complex. Subluxation complex is just not a hypomobility. It has been degenerated down, and the science has been lost because of terminology and misunderstanding, misrepresentation. A subluxation or a spinal problem is not just a hypomobility, it's a hypermobility. And what I would mean by that, doctor, is if you actually took your next 10 patients that had chronic pain or that were injured. They had a work injury or they had an injury in an auto accident. What I'm going to show you on x-ray is that they will have a lot of excessive motion in the spine. That's called hypermobility. Now, it'll also show you that you've been adjusting hypermobilities for your whole career. If you could not adjust the hypermobility, so if clinically you could not adjust the hypermobility, then let me ask you this question. And these are excellent questions. Okay, look at this one right here. Oops. Here's a study of a trauma patient. Okay, and they're having severe headaches and severe pain in their mid spine. They're also having problems with some shortness of breath and difficulty breathing as a result of the trauma. If you cannot adjust the spinal instability, well, then in this study, which segments can you adjust? Well, in this segment, you would only have available to adjust C6 or maybe C7 because we don't have that tested, but you wouldn't be able to adjust any of the vertebra above this. So the idea that you cannot adjust a spinal hypermobility is one of the most ludicrous ideas that ever came into the profession of chiropractic. If you look at the original subluxation inclusion parameters in Medicare, they included hypermobility. It was a large component of the subluxation complex that it was communicated that doctors of chiropractic adjust today. It is absolutely, do you realize that a hypomobility, that the research shows that you increase the mobility in a hypomobility that lasts less than a week and that or less than a week, and then it has no greater impact than massaging the spine? So that line of thinking has led chiropractic, the profession of chiropractic, to me, into a really, really limited, I mean, how many of you are happy today with your insurance reimbursement in general insurance? Because that theory is what has caused the reduction in x-ray. That's what has caused the reduction in costs. See, here's the idea of that idea, and not to jump on a rant here, but there are clinics, I won't name them, where you can go in and you can have a very simple exam. It's almost not an exam, and you can start receiving adjustments right away. And there really is no basic. There's no X-rays. There's no anything. You're just starting to get general manipulation. And it's based on the idea that somehow the provider can feel a hypomobility. Okay, now I can go into those clinics, and I have gone into those clinics, and I can receive an adjustment for $10. Okay, that's because there's no science required. What I'm trying to do is seriously build it up, is to redevelop and revitalize the science that's there. And so once you start looking into ligaments, you'll understand, boy, not only are you adjusting spinal instabilities or hypomobilities, it's your mission. But you also can't, that doesn't mean that if the spine's half tore off and you're a chance of, this is a surgical case that needs to go get a emergency fusion right away, you're going to do an adjustment to fix that. So there's gradients of instability. But absolutely. Let's do, thanks, I've been doing ligament measurement evaluation since school. Many legal types just don't get it. Yeah, they don't get it, but the worst thing is, doctor, is if you don't get it and you get it. So just persist. That's all I'd say. Continue. Okay, doctors. The next webinar that I'm going to give is on low injury, low impact, or no injury, no impact. I'll completely take out the science on that and show you that there is no science with that. And I'll show you the science counter to that I think you'll really, really like. So I appreciate your time, your attention today. And as always, have a fantastic rest of the week. And I urge you, if you're not ligament testing, start ligament testing. I mean, if you want to become a seriously increased, improved professional, I know that it did it for me, and it changed my life, and I know it can change yours and the life of your patients as well. It's not like you just do it and all of a sudden it changes. You have to apply it. You have to start to learn. But the more you learn, the more you earn, because the more society will repay you with what you know, what you've learned. So doctors, take care. Thank you very much, and have a good day.